community-based participatory research program was exactly what I was looking for. I am a researcher and a clinician, and I really wanted to go outside of the university to understand the experiences of folks in the community, of their experiences in participating in research, but also their desires and what they want from research.
I think that the program is a wonderful program. It's a great way for researchers and doctors to connect with community people in an authentic way, in a natural way. It was a great opportunity for everyone to be on the same page and be equals.
So it provided a setting where we can meet a lot of different community partners with different levels of experiences in the community, but also in the research world, which led to a lot of rich conversation.
It was an eye-opener because I've been doing research in the community in the grassroots level for a long time. And so they kind of found out through being involved in how sometimes people don't really do real research. They just go into the community and try to bring to the community something that they did research on, but that has nothing to do with the need. So there I was able to realize, okay, there's people out there that are interested in finding information or finding the needs that are in the community, but actually being told by the community.
I work in a community setting, I'm a community member, I'm also a professional. But being able to bring the voice of those who often don't have a voice and often aren't able to sit at the same tables, for various reasons. And I saw some of that reflected in the way Carlos would share out information from his experience, from his, professional sphere, and I really appreciated and valued that. And then one thing I absolutely loved as well was with Tuma. She represented community still, but she was also faculty and had a lot of that knowledge and that research experience, but also was not a type of person to get caught up in accolades and credentials and being a doctor or this or that. She in our group was authentically like one of us.
CBPR courses gave us the right conversation and space so that we could get to know the members of the group. We specifically spoke about our interests during our courses and had a chance to really hear what our passions are. And for a lot of the community-based folks, it's kind of interesting when you ask a researcher what their passions are. You can look at their CV, but then there's so much more to that. And I felt like the CBPR course gave researchers a chance to show their very, I don't know if this is the right way to put it, their human side as well. Like, we're multifaceted people, as Alicia pointed out. But then you also get to hear about the various passions of your community-based partners who also hold many different hats professionally and as people in the different roles they play. So I think just, we all had this interest in mental health, and I have a specialty in child mental health. And in child mental health, you're always talking about parents and families as well.
My interest was in finding out how substance abuse was affecting the children in the Latino community. That was my goal in there. And then she mentioned something that was interesting, which was the stigma. Why isn't the kids getting the services? Why do the parents start giving the services? And I see that happen so much that I just jumped right into it. I said, okay, so that's how we connected.
As a mother and having 3 adolescent children, and wanting to ensure that their needs are met, I myself have come across some barriers navigating certain aspects of health. And Tuma was sharing some of the body of her work, and immediately I felt like it just hit like a ton of bricks. I said, this is definitely an area where I would like to pursue more.
Our project is designed to understand the barriers that parents face when seeking mental health services for their children. So we're going to start the project off by doing a general survey and getting a sense of what our specific parents in Rochester city area, what kind of barriers they face. So in our research, in our literature search, we found that there are, several programs that are available to decrease these barriers. In different cities, programs have come up and are now considered, evidence-based and are well-researched. And the question is, well, why don't we have those programs here? There could be a variety of reasons of why we don't have those programs here. As we know in the research world, once you come up with a evidence-based program, it's very hard to disseminate that widely for a variety of reasons. But I think what's really important is that we have to find the right fit for our community, because every community is unique with its resources and strengths, and we have to be able to take a personalized approach to identifying that and then match the intervention to what the community needs. So in that way, we're using a very community-based participatory research style of saying, what are the barriers that our Rochester City families face when seeking services for their children with mental health concerns, and what ideas do they have? What do they think would benefit them the most in bridging that gap so that they can get services more quickly to their children? So we hope to develop community action plans and be able to involve the community in actually coming up with the solutions.
The plan is what's needed, because I see the parents and I see the kids, and those parents are not letting their kids get their services the way they should. And so if we find out how can we help families, especially single moms and single dads, be able to provide us to get the services for the kids, then that makes a whole world of difference there. I call each other the A-team, because everything that we talk about it makes sense, and we have a passion for it.